All right, moving into one of the more popular modality units is massage. 3 massage techniques that we'll be learning: Swedish, transverse friction, and edema reduction. Swedish massage is the type of massage that is typically used in spas and salons and massage clinics for decreasing muscle spasms, adhesions, and postural strain. The primary strokes that we'll be learning in lab or that you're watching on the video include effleurage, petrissage, and tapotement techniques. A few guidelines for Swedish massage are: make sure that your hands are warm and dry and clean. Maintain good posture because you'll be doing a Swedish massage for probably anywhere from 15 to 30 minutes, and it can be fatiguing on your own body. Pressure will then be delivered through more of your body, not your arms. So again, we're going to be practicing this in lab to make sure that you're not working only from the shoulders and the hands. Change the pressure depending on the amount of tissue and avoiding bony prominences and painful joints. So it feels good to have muscle massaged and blood flow move through muscles. It does not feel good to have the periosteum smashed into the bones. So stay off the bony prominences. Maintain constant contact with the patient so they know exactly where you're at. Swedish massage should not be painful. And the pressure should be in line with venous flow. So imagine always pushing fluid towards the direction of the heart. Transverse friction massage is a very different kind of massage. It's used to break up adhesions or decrease pain in a small area that we call a trigger point. It's often used with chronic tendon inflammation. We will not be using a lubricant of any kind because we will be pushing and sliding the ends of the fingertips over the inflamed tissue. And if we have a lubricant, all we're essentially doing is causing abrasions on the skin. And during this treatment, we'll be keeping the tendon that we're treating on stretch. So for this example of lateral epicondylitis, we would want to have the person with their elbow maybe a little more extended to put it on stretch, and then the wrist flexed to stretch those extensor tendons. If you're treating a patellar tendon, then you would want to have the knee in flexion. Edema reduction massage then is the third technique that you'll learn. So if you can imagine that somebody's ankle is pretty swollen and it's been maybe 5 or 6 days and they aren't painful to touch, you could perhaps start some edema reduction massage starting at the proximal area of the injury and apply pressure towards the heart. So you'll just massage maybe up around above or more proximal to the malleoli for a minute or two, and then you're going to move about an inch or so more distal. So maybe distal to the malleoli, and you'll do the massage towards the heart from there. And every couple minutes, you're going to move even more and more distal. So you don't start the massage at the toes and push all the way up past the ankle. That would actually clog the lymphatic system, and you can't get the lymph to move. So we move a little bit at a time and then move more distal, and that's called uncorking the edema, which is really an effective way to decrease edema, especially in the ankle or distal extremities. So we'll practice these in lab.